If you have ever tried to follow menopause advice and thought, why isn't this working for me? Everyone says this supplement is amazing, but I feel no different. I'm doing everything right and I still feel awful. You are not imagining things and you are not failing. The truth is simple. One size fits all menopause advice fails because menopause is not the same experience for every woman. What works beautifully for one woman may do absolutely nothing or even make things worse for another. Hi, I'm Anna, and I help women make sense of menopause so they can stop guessing, stop feeling dismissed, and finally understand what's happening in their bodies. And in today's video, I'm going to explain why generic menopause advice often misses the mark and what you should focus on instead if you want a real relief. My dear, the biggest myth in menopause is that every woman goes through the same symptoms and needs the same treatment. Yes, I still hear this often, and it's further from the truth. Some women experience hot flushes and night sweats, weight gain, brain fog, anxiety, depression, joint pain, insomnia, vaginal dryness, hair loss, heart palpitations, fatigue. Others may have only a few mild symptoms. And some women are completely blindsided by symptoms so intense that they feel like they have become a completely different person. Menopause is highly individual. Your symptoms are shaped by your hormone patterns, genetic, stress level, sleep quality, diet, gut health, trauma history, existing medical conditions, nutrient deficiencies, lifestyle habits. That means your journey is unlike anyone else. Here is where things get even more interesting. Two women can have the exact same symptom, but for completely different reasons. Let's take fatigue. One woman may be fatigued because of low estrogen, another because of low iron, another because of thyroid dysfunction, then another because of poor sleep due to night sweats, and another because of high cortisol and chronic stress. If all 5 women are told to take the same supplement, only one may improve. The others will still be exhausted. This is why symptom-driven, root cause focused care matters so much. Even in hormone therapy, often considered the gold standard, must be individualized. Some women do very well on estrogen patches, gels, sprays, oral tablets, vaginal estrogen. Others absorb hormones differently. One woman may feel fantastic on low dose patch. Another may need a higher dose. Another may experience side effects and require a different delivery method. Personal factors that influence treatment include age, time since menopause, cardiovascular risk, blood clot history, migraine history, breast cancer risk, uterus status, symptom severity. There is no single best hormone therapy for everyone. Then let's not forget that not all menopause happens naturally. Some women experience natural menopause when hormones decline gradually over the time. Surgical menopause when ovaries are removed and it causes sudden hormone drop. Then medical menopause, which is a result of cancer treatment that suppresses ovarian function, and also premature menopause, which occurs before age 40. Each type creates different challenges. A woman in surgical menopause often experiences more abrupt and severe symptoms than someone transitioning gradually. Again, individualized care is essential. Let's look at some common examples of one-size-fits-all advice. Like, take black coffee. Helpful for some, ineffective for many, and not always appropriate. Or eat more soy. Useful in certain cases, but not universally beneficial. Or just eat less and exercise more. This often backfires when women are dealing with fatigue, joint pain, poor sleep, and elevated stress hormones. Or do high-intensity interval training workouts every day. Excellent for some women, too stressful for others. Or this supplement fixes menopause. No single pill addresses every symptom and root cause. These blanket recommendations ignore what is actually driving your symptoms. Personalized care starts with one question: what is happening in your body? That means looking at your symptoms, their intensity and patterns, medical history, nutrient status, sleep, stress, lifestyle. Then creating a tailored plan. The plan may include hormone therapy, targeted supplements, nutrition changes, stress reduction, sleep support, strength training, gut support. Not because they are trendy, but because they fit your unique needs. This is exactly why I created my symptom-driven approach inside the Pause Well. Instead of handling every woman the same checklist, I help women identify their most disruptive symptoms, the likely root causes, and personalized strategies to address them. Because your hot flashes are not the same as your friends. Your weight gain is not caused by the same factors as someone else. And your solutions should be just as unique as your symptoms. When you stop following generic advice and start using a personalized approach, everything changes. You begin to understand why you feel the way you do, what your body actually needs, which strategies are worth of your time, which ones you can safely ignore. And instead of feeling overwhelmed and defeated, you will feel empowered and in control. If you have been trying every menopause tip you see online and still do not feel better, the problem is not you. The problem is the advice. Your menopause journey deserves a personalized approach. That's exactly what we do inside the Pause Well. If you would like support identifying the root causes behind your symptoms and creating a plan that fits your body, check the link below to learn more. And if this video helped you, subscribe to the channel and share it with another woman who needs to hear this message. And remember, your menopause is unique, so your solution should be too.